Good afternoon. So I'm Chris Gilligan. I'm going to be speaking about restorative neurostimulation for chronic low back pain. Why do we study chronic low back pain? It's one of the leading causes of years lived with disability worldwide. It's a major reason why patients are on chronic opioids. It's a major driver of direct and indirect costs. And 2/3 of chronic low back pain is predominantly nociceptive, and that's the type of nociceptive chronic low back pain that we're treating with this therapy. So how can we summarize our one-year data? Well, 64% of our patients had a 50% or greater improvement in their low back pain VAS. 52% of our patients were remitters with a low back pain VAS of less than 2.5 centimeters. 78% had a 10-point or greater improvement in their ODI, and 57% had a 20-point or greater improvement in their ODI.